Mr. Speaker, I move to suspend the rules and pass Senate Bill 3201, the temporary reauthorization and study of the Emergency Scheduling of Fentanyl Analogs Act.
The clerk will report the title of the bill.
Senate 3201, an act to extend a temporary scheduling order for fentanyl-related substances and for other purposes.
Pursuant to the rule, the gentlewoman from New Hampshire, Ms. Kuster, and the gentleman from Oregon, Mr. Walden, each will control 20 minutes. The chair recognizes the gentlewoman from New Hampshire.
Thank you, Mr. Speaker. I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and include extraneous materials on Senate 3201.
Without objection.
Mr. Speaker, I yield myself such time as I may consume. Mr. Speaker, we as a Congress have worked over the past several years to combat the opioid epidemic and support the millions of Americans with substance use disorder. That work includes bipartisan passage of legislation like the 21st Century Cures Act, the Comprehensive Addiction and Recovery Act, and the Support for Patients and Communities Act. In 2017 and 2018, we appropriated nearly $11 billion for a total of 57 federal programs that fund efforts to curb this epidemic. These programs span the continuum of care, including prevention, treatment, and long-term recovery. The funding also spans across agencies, directing investments toward research, public health surveillance, and supply reduction efforts. Most recently, in fiscal year 2020 funding bill, we included over $4 billion in public health dollars to help with prevention and treatment. In December, the House passed H.R. 3, the Elijah E. Cummings Lower Drug Costs Now Act, which included an additional $10 billion in funding to support public health efforts to combat the opioid epidemic. On the Energy and Commerce Committee, we have had the chance to hear directly from states that our work at the federal level has helped save lives. Last year, in my state of New Hampshire, a total of 284 deaths were attributed to drug overdoses, of which 82%, 234 deaths, involved the use of fentanyl. This is an alarming statistic and the frightening reality of opioid addiction in our communities. It is crucial that we understand the significance of synthetic opioids. As we have seen in New Hampshire and around this country, though the most recent data has indicated overdose deaths have plateaued, deaths from synthetic opioids continue to rise. This is primarily fueled by illicit fentanyl and substances structurally related to fentanyl, which we commonly refer to as fentanyl analogs. These drugs are often far more powerful. Fentanyl, the most well-known of this class of drug, is approximately 50 times more powerful than heroin and 100 times more powerful than morphine. And although it is used in legitimate medical settings, we have seen a proliferation of illicitly produced fentanyl, fentanyl analogs, and its precursor chemicals originating from China. Because fentanyl is relatively easy to make and so potent, it is tragically leading to large increases in overdose deaths. 1 kilogram of fentanyl purchased in China for $3,000 to $5,000 can generate upwards of $1.5 million in revenue on the illicit market here in the United States. That is potentially enough to kill 500,000 Americans by overdose. We have all heard the terrible numbers that tell this story. In 2017, there were over 47,000 opioid overdose deaths, and 28,000 of those deaths involved synthetic opioids such as fentanyl in the United States. A more complicating factor is that we're now seeing fentanyl increasingly mixed into other drugs like cocaine, methamphetamine, and even counterfeit prescription drugs like oxycodone. This means that many unsuspecting Americans are dying at the hands of fentanyl when they didn't even realize they were taking it. Mr. Speaker, the nature of our nation's fentanyl problem is far more complex than drug epidemics of the past. In addition to traditional routes, users can purchase fentanyl analogs and fentanyl precursor chemicals online on the Internet. These purchases, which typically include the most pure and potent fentanyl, are often packaged and shipped through the United States postal system or consignment carriers in small quantities, making detection a significant challenge. These factors create a complex problem which requires a multifaceted solution. Part of that solution is finding a way to support both public health and public safety actions aimed at stemming the tide of overdose deaths. In February 2018, the Drug Enforcement Agency used its authority in the Controlled Substances Act to temporarily place for 2 years all illicit fentanyl-like substances in Schedule 1. With this authority expiring in just 9 days, we must do more to understand the true impact of this temporary scheduling order, including its impact on public health, public safety, research, and federal criminal prosecutions. That is why today we are considering Senate 3201, the temporary reauthorization and study of Emergency Scheduling of Fentanyl Analogs Act. This bill, which passed unanimously out of the Senate, would extend DEA's temporary order for 15 months, while also tasking the Government Accountability Office with an evaluation of the temporary order. Placing a whole class of fentanyl-like substances into Schedule 1 does not come without implications for criminal justice and research. The National Institute on Drug Abuse notes that obtaining or modifying a Schedule 1 registration involves significant administrative challenges, and researchers report that obtaining a new registration can take more than a year. It's critical that our response balance the need for legitimate research access that holds potential for improved treatments for pain and addiction, while also prioritizing a more long-term solution to the dangerous trafficking of fentanyl analogs. This temporary emergency scheduling order also has international implications. A year after the United States moved to schedule all fentanyl-related substances, China finally announced that it would act and do the same. This class-wide control in China has slowed the rate of new fentanyl analog encounters in the illicit market. An expiration in 9 days would also put the DEA back in the position of playing whack-a-mole, scheduling fentanyl substances one by one, while clandestine criminal chemists in China work to stay one molecule ahead of our efforts. As founder and co-chair of the Bipartisan Opioid Task Force, I agree with many of my colleagues that we cannot arrest our way out of this epidemic. And that's why I have introduced the Humane Congressional Health Care Act, legislation to repeal the Medicaid inmate exclusion and allow justice-involved individuals to access quality health care, including mental health treatment and substance misuse services. The complexity of the fentanyl crisis and creation of other synthetic drugs demands a thoughtful, balanced approach that protects the public health and public safety of all Americans. This temporary extension, coupled with the GAO study, will give us the time to work on a longer-term solution, and will also give us the opportunity to better understand the full range of implications that come with class-wide scheduling of these substances. I urge my colleagues to support this measure, and I reserve the balance of my time.